So let's get started, okay? So this is the first day that we're going to start talking about knowing your options in birth. So I wanted to kick off kind of starting about your birth support team and what your options are for kind of, setting up your team and who's going to be there with you on the big day, right? Okay, so your first person who's usually there with you, most women end up seeing an OB, so an obstetrician or gynecologist, so your OBGYN. That's kind of the most common, provider that a lot of women go to, especially in the United States. And if you see me kind of looking sideways, it's to make sure I'm not missing any questions from my group. So again, if you have questions, post them here and I will respond. If not, I'll be checking for the group too. Okay, so back to your OBGYN. What does an OBGYN do? Well, they provide your regular women's care. So we're talking your annual pap smears, mammograms, all the things, right? And then when you're pregnant, you typically will get your entire prenatal care from your OB. Your OB is medically trained, so they are a doctor that can perform surgery if needed. And they also take care of your labor and birth, so they can be there for the birth of your babies. They don't deliver babies. Women deliver babies. Mommies deliver babies, but doctors are there to kind of help and catch and, do all the things there, right? What's their expertise? So an OB/GYN's expertise is typically a high-risk pregnancy and surgery because they are medically trained and they can do surgery. So if you've been seeing an OB your entire life and you're having a very normal, healthy, I don't want to say uneventful, but very healthy pregnancy, you may consider alternative options since they are medically trained. Doesn't mean you have to. It's just something to kind of, some food for thought. Now, where do OBs typically work and where do they typically practice? They usually you'll find them in the hospital or in a birth center inside of a hospital, which is kind of a relatively new thing, but they are out there depending on where you are in the country. As far as medical interventions go, and when I talk about medical interventions, I mean things like inductions like Pitocin or birth interventions such as pain management meds, forceps, the use of a vacuum, assisted birth. So interventions, when I say interventions, things like that are more common amongst OBs because they tend to have a more medicalized approach to your overall prenatal care and to your birth because that's their background, right? Like they're medically trained. So they will tend to err on the side of a little bit more medical approach to your birth. Not a bad thing, it's just it tends to be what a lot of women find, right? So what is your OB experience typically like? I personally have been to OBs, I've been to midwives, and I've worked with a lot of women who have been to both. OBs kind of are all over the board, right? So while they are medically trained, there are some OBs that tend to err on the side of, having a little bit more of a natural and holistic approach to your health. But generally, I'll say that because they're medically trained, they do have a more medicalized approach. And so when you're in your appointments, your prenatal visits, so in the beginning of your pregnancy, you might go in around week 8 or so for that first sonogram to kind of confirm your pregnancy. And then you'll go in maybe once a month throughout most of the pregnancy, assuming there's no complications. And as you get closer to the end, your appointments begin to increase in frequency. Now, as far as your individual appointments go, what most moms find is that appointments with your OB don't tend to be that long because they're very busy. So they have a lot of patients to see, and it's not a super common thing to spend a long time with your OB. Now, again, this is a very broad statement. So some OBs are much more kind of relaxed and take a lot more time with women and will sit and answer your questions more thoroughly. But what I feel like women find is that it's a little bit less about the conversation and more about kind of that medical approach to making sure everything's okay, making sure mommy's okay, that baby's healthy, and that's that, right? Unless you bring up questions. So it is your responsibility, mom, to come up with your questions, to be doing your own research, and to come up with things that you want to talk about at your appointments. So that kind of covers our OBs. I get asked a lot, what is a midwife and what's the difference between a midwife and a doula. So I kind of want to move on to the next, to our next person who would be on our birth support team and who's an option in our team. And that's a midwife, okay? Just to clear up what that is. And I didn't hear of a midwife until my second pregnancy. I had no idea what that was or what they do. So I started seeing a midwife my second pregnancy, and I've stuck with midwives since. Personally, I have had really fantastic experiences with midwives. They also, like an OB, can provide your regular annual women's care. So your pap smears and things like that. Your prenatal care, they can cover, monitor you throughout your pregnancy as well. Now, they do tend to specialize in low risk pregnancies because midwives cannot do surgery and cannot handle high risk situations for women. So if you are having a high risk pregnancy, you do need to be seeing an OB or a specialist. If you have a low risk pregnancy, a midwife may be an option for you. Again, a midwife cannot do surgery, but they can do the rest of your routine prenatal care, your well women's care, and they can also be there for the birth of your baby. Again, midwives and doctors don't deliver babies, women deliver babies, but the midwife can be there to do the same thing an OB would do. So to catch the baby and to kind of guide you and be your support person, right? What type of midwives are out there? So there are several different classifications, and if this is something that's of interest to you, I would urge you to go online and do a little bit more research to find the type of midwife that you're most comfortable with. And just to quickly kind of name them off, you have a certified nurse midwife, which is a CNM. You have a certified midwife, which is a CM, a certified professional midwife, and a traditional midwife. Okay, so there's just different classifications depending on basically their education background, right? So also to know about midwives is they do tend to work with physicians when needed. So what you'll find is pretty common if you're seeing a midwife, group, there may be multiple midwives, maybe 1, 2, 3, or more doctors, OBs as part of their practice as well. So that if a woman becomes more of a high risk situation or needs some type of higher level care like surgery, the doctors are there as their backup, okay? So that's kind of a common thing that you'll find. Where do midwives work? Well, there are midwives that will come to your home if you want to have a home birth. And I've had a lot of questions about this privately because of my last birth experience. A lot of people ask me things about, having home births. So if it's something that's of interest to you, there are a lot of midwives who do home births, right? So you can actually get all of your prenatal care at your home. You can have them come to your home when it's time to, have your baby, when you're in labor. So there are also midwives who work at birth centers, which is another great option depending on what part of the country you live in. And birth centers sometimes look like a home or are a renovated home with each big bedroom a birth room. And it's a very comfortable, relaxing setting that looks like you're at home, but you're in this birth center and they have access to a lot of tools. I think this old mindset of what midwives do and come in with towels, that's just not how they operate anymore, right? They come in, if they come into your home, they are fully equipped. They have the tools, they have the gear, they have the things, right? And so, it's same thing with birth centers. When you go to the birth centers, they are fully equipped and ready to rock and roll. And then you also have midwives that work in hospitals. So my second birth, I worked with a midwife who was in a hospital and I had a fantastic experience. And then again, because for the women who are more comfortable birthing in a hospital, you have the kind of benefit of having midwifery care in a hospital backed by, if you want that support, that medical support, you have that there as well, which is kind of nice, right? So that's an option too. We talked about medical interventions a little bit before, but I want to bring that up again because what you'll find working with midwives is that generally speaking, again, this doesn't apply to all midwives, but generally speaking, you are less likely to experience birth interventions when you're working with a midwife because they tend to have a more holistic approach. Now, this isn't every midwife. There are some very clinical, midwives that err on the very clinical side, but I feel like generally speaking, they are a more holistic group of providers. So they will tend to, take a more holistic approach to your care, right? Okay, so, and then what is the midwife experience typically like? So different than your OB is what a lot of women feel like when they see a midwife for the first time. First off, most midwives are women, right? And so women tend to kind of talk a lot more. So when you go to your midwives appointments, a lot of women feel like they're getting a lot more support, a lot more one-on-one time, a lot more personal question and answers and support, and really exploring what they want out of their birth, what their questions are about their options, pain management meds, all the things that come up. So a lot of women tend to report and discuss, that their experiences with midwives tend to be much more supportive. Okay. So I want to mention one more person who, if you give birth in the hospital, will be there as well. Let me get a little bit of water because I am still recovering from the flu and this secondary infection, which was like terrible. And again, if you guys hop on, let me know, say hi. Okay, so another person that you'll find if you're giving birth in the hospital that could be part of your support team is your labor and delivery nurse, right? Your L&D nurse. So what's their job? The labor and delivery nurse is there to support you, the mom, during labor and birth. They're going to be doing things like monitoring your vitals and checking your blood pressure, your contractions, your heart rate, checking the baby constantly. They do a lot of charting, and they are busy, right? So nurses tend to work with a ton of patients at one time. They work in 12-hour shifts. So every 12 hours they will rotate. So if you are a first-time mom or even a second-time mom experiencing a little bit longer of a labor, or you fall in between shifts, don't be surprised if they switch shifts during your birth, because they tend to work 12-hour shifts, right? They do assist doctors, so they report to doctors on the charting and what's going on with your labor, what your progress has been like. So that's kind of, what the labor and delivery nurse, what her job is. I say hers, it's usually women, not always, but usually. And then as far as your experiences with labor and delivery nurses, it is a huge range. And depending on where you're at, what hospital you're in, what shift is going on when you arrive at the hospital. I mean, it is a huge range. So it's like you never really know what to expect. And there are a lot of incredible labor and delivery nurses. I mean, absolutely incredible, that are truly changing women's lives. And then there's some that just aren't, as crazy about their job maybe, or as into it, which is super unfortunate, but it's just a thing. And so the reason I'm bringing it up is because I want women to kind of be prepared for knowing what to expect when the day comes, and what your options are, right? Okay, so now let me kind of explain the difference a little bit between a midwife and a doula, because I get asked this question a ton, because a lot of people still aren't even clear what doulas do and what, who they are, what they do. So I wanted to kind of clear that up a little bit when we talk about knowing our options in birth. I think it's important to understand who our support team might be, right? Okay, so a doula, a birth doula, is kind of like a birth coach. All right, so doulas are not medically trained. So they will not give medical advice. They will not do cervical exams or anything like that, and should not. Rather, a birth doula is your birth coach. So somebody that will provide continuous support to you during your labor, okay? Also, that person will be your resource throughout your pregnancy, birth, and postpartum period. So if things come up during birth and you have questions about what's going on during your birth, your doula is there to help you find information, so that to help you make decisions of, for what's going on, right? So the doula is kind of your person during your birth. She provides physical support. So when I say physical support, I mean massage, I mean comfort, soothing words, movement, helping you get into different positions, which doesn't sound like a big deal, but it kind of is. Hey, Maeve. But it kind of is hard physically to move around and get into different positions when you're laboring. It's hard to move when you're that far pregnant anyways, but when you're in labor and you're pretty uncomfortable, it can be really hard to move. So just physically having somebody to help you get up and move around, or even encourage you, because it can be very straining and exhausting on mom. So to have somebody there that's like, hey, why don't we try this with the next contraction? Why don't we move this way? Why don't we try that? So somebody who's there physically to support you. That might mean brushing your hair. That might mean physically bringing you your drink with a bendable straw so that you can stay hydrated. That might mean helping you to the toilet so you can be going to the bathroom every hour and making sure that you're empty. Hey, what's up? Oh, yay, I'm so glad you're here. Making sure you're emptying your bladder every hour, which is super important during labor. Your birth doula will also provide you with the emotional support, okay, which is also a big deal. So sometimes just having somebody talk to you, and when you're going through something challenging, to kind of coach you through it and talk you through it and help you to stay calm, help you to stay relaxed, help you to stay confident leading up to your birth, during your postpartum, all the things, right? So somebody to be with you there continuously throughout labor. That's what your birth doula is going to be doing. She'll offer techniques to manage your contraction intensity. Like I mentioned earlier, trying different positions, but also maybe trying different massage techniques, different tools. So if you've taken any of my other classes, I've talked about the use of a rebozo scarf. So she may be able to, bring a rebozo scarf, bring some other massage tools to help with contraction intensity, right? Answering questions about what's happening during labor. So questions might come up. Birth is unpredictable, right? Even with the very best birth plan, which I had a birth plan with baby number 3, and it did not include giving birth on the bedroom floor, but it happened, right? And even still, a lot of my wishes were honored. So you can still have somebody there with you kind of who knows what your preferences are, who knows what kind of birth you want to have, and to help you honor that and to help you answer questions and get information you need to answer questions as things progress, as things shift away from plan, which happens, right? So having that person there for you. Let me reiterate that a birth doula does not offer medical advice. Okay. The benefits to using a doula, if you haven't already, if you have, chime in and let me know what your experience was. I'm a doula and I've hired doulas. So I had a doula for my second birth because that was the first time I'd ever heard of a doula. I hired a doula with my third birth, and yeah, I love, oh, you have a rebozo. They are amazing. There's some great videos too on Spinning Babies has some of the best resources for how to use a rebozo and things you can do with them during birth. They are like a power tool. And it's an ancient Mexican culture scarf that they use during birth, and they are incredible with what they can do for women in baby positioning and help with the pain. Rebozos are amazing. Okay, so back to the benefits to using a birth doula. Women who work with a birth doula are less likely to experience birth interventions, and we kind of touched on the interventions earlier, but I'm talking about Pitocin, pain management medication, forceps, the use of a vacuum. Because you have that support person there with you, because you have somebody working with you through each contraction, women that use a doula are far less likely to need those interventions or to want to use some of those interventions. Including a reduced chance of having a cesarean. And that's kind of you have to be careful how you talk about that, but the reality is, if you're not using as many interventions, then you're just less likely to end up needing a cesarean. Not to say a cesarean won't happen if you use a doula. They absolutely can, and they absolutely do sometimes. It's just you have a better chance at avoiding it if possible, right? Okay, and then also better APGAR scores for the baby, which is that very first, when you first have the baby and they kind of check all these little things out. Women who use a birth doula their babies tend to have higher APGAR scores at birth. Greater satisfaction overall with their birth experience, more confidence, lower anxiety. Doulas tend to be very calm women. I know I'm not super calm right now when I come live because I'm so freaking passionate about birth. But each moment has its own thing, right? So in birth, I tend to be, even in my own, I felt like I was pretty calm considering what was going on here and how it was all going down so quickly. Women who work with a birth doula tend to have higher self-esteem leading up to their birth, more confidence, they're more prepared. They, during birth, tend to have better movement, which is just great for labor. The more you can move, hey Randy, what's up? The more you can move around because you have somebody there who's skilled and who knows what she's doing to support you and help you move around during labor, right? Improved postpartum mental health. Huge. huge, because the rates of postpartum depression and postpartum mood disorders are outrageously high. And in my opinion, probably not documented as often as they occur, because I think there's a stigma, and I think a lot of women are ashamed or embarrassed to admit that they had postpartum mood disorders. So the statistics are out there, but I think that they are grossly underreported. So anything that you can do, as a mother, as a pregnant woman, and you're about to have your baby and you become this new postpartum person, to have that support system, your postpartum doula, your birth doula even, will come and, kind of be your support through your postpartum as well. So be there for you to talk to them, to bounce ideas off them, just to vent, just to have somebody who understands and to listen to you, and to let you know that you're not the first person who feels this way, that you're not by yourself. Women, mothers all over the world experience this, right? Hey, breastfeeding your now 6-week-old. Crazy that I've literally watched you every single time since I was 15, 16 weeks pregnant. I love you, Randy. Yay. My doula has definitely helped me feel super confident. I can text her any time of the day and she reassures me. We've talked about my birth plan. I feel so much better about going into labor as a first-time mom. I love that. See, yes, that's exactly what a doula should be doing, right? They're also really good for partners, because I think that it's common to kind of gloss over men and men's experiences, the father's experience at birth. It hasn't historically been, we're talking women have been doing birth forever and ever, right? We've always been the ones giving birth. But really the fathers have only been a part of birth for the last generation, maybe two. So maybe our father's generation, maybe not so much our grandparents, depending on where you're from, how old you are, and so on. So, our dads, and obviously if you have a wife, then this doesn't apply to you, right? But generally, the dads, their experience gets, kind of ignored. And so I think that I can't speak for men, but I can only speak to what I see and, what men have confided in me, or that other moms have confided in me about their men's experiences. And it can be kind of scary for men, because they aren't used to seeing their significant other experience pain. And I think that it's hard for women to go through that, right? But it can be hard for the man too. From the outside, men want to feel like they're helping. They want to feel useful, but they don't know what to do, right? So they might not know how to manage this, how to handle this. And I don't think that they can always remember that this is only a temporary situation. Like the pain that you experience in birth, you're not going to be in pain like that forever and ever. It's only, for a contraction, and then another contraction, and then another contraction. It's intermittent discomfort that's going to end, right? When the baby comes out. I mean, there's a series of, discomfort and pain that you deal with postpartum as well, but that's a different thing. My husband was skeptical about hiring a doula, but after he met and talked to her about her role, he was all about it. It's taken a lot of pressure off him. That's amazing too. That's huge. And, my husband loved hiring doulas. When I first introduced the idea to him, he's like, yes, right away. I think he was more gung-ho about it than I was at first. And this is before I became a doula, because it takes a lot of that pressure off of them. You're right. And then it allows them to be a part of birth as much as they want to be a part of it, So a doula will never replace your husband. A doula will never replace your partner, right? Or dad. Like, she could never do that and would never. And she can, for some partners, for some couples, some families that are going through birth, for some people, the doula is more of guiding the husband with how to support the mom, right? And then being there as a backup. So if dad wants to go take a break, or if dad needs a nap, or to go get something to eat, if a woman's in a hospital and unable to eat, it's kind of crummy to eat in front of her. So if you have a doula there to say like, hey, go slip out, grab a sandwich, and I'll stay with her, then you have that, in my opinion, it can't hurt to have more than one person on board to support you, right? As long as, especially if you have that connection, if it's somebody that you truly have connected with and that understands your birth preferences, and like Maeve's describing, like understands her role, you guys are very clear about communicating your expectations, I think is huge. Sorry, my throat's a mess. So yeah, when you talk about men and doulas, I do think that there are a lot of men who get a little bit intimidated by bringing in another person, right? And even some moms feel like, oh, I don't know if I want to bring a stranger into my birth. But here's the thing. Here's what I want to tell you. The nurses, they're going to be strangers to you the day that you go into the hospital. You probably have never met those nurses before. And they change shifts. So if you're there for, depending on where you fall, you might have a couple different new people coming in. So, those are brand new faces, right? Where your doula, you have met a few times, maybe only 2-3 times in person, but you have that bond. You've met somebody that you connected with, right? And so you do have that familiarity with this person, as opposed to walking into a hospital and having these nurses there. And nurses' jobs are not to comfort mom and to rub her back and to sit by her side continuously. That's not her job. She has a job and she's very, very, very busy. Her job is to make sure that you are healthy, that your baby is healthy, and that she's reporting to the doctor for multiple women at a time, where your doula stays with you one-on-one, right? So kind of getting the difference here, right? Okay. And so, and a good doula would never try to come in between a couple. She would support and try to encourage, and be very conscious to include dad to the extent that he wants to be included, right? My second birth, I had an epidural. So once I had the epidural and when it was time to push, there wasn't a whole lot physically for my doula to do. She was bringing me cold, wet towels for my forehead, which felt amazing. She was bringing me ice chips, doing little things like that my husband would never have known to do. And a lot of dads don't know to do because the nurturing thing for men sometimes doesn't kick in until they're dads. And even then still, I don't know that it always does, really. And so she was doing this, but then she also grabbed my phone and said, would you like some pictures on your phone while we're here? I'm like, yes. I didn't have a birth photographer. So I had a ton of photos. I've posted some of them in the group and on my Instagram. But she was taking pictures with my phone, which was just, a really helpful thing that I hadn't even thought of. So she'll find her way, she'll find where she needs to be in the moment and kind of, help there. The last thing I didn't mention that your doula will usually do is stick around after you have the baby for maybe an hour or two and help you with that initial breastfeeding latch. So lactation support, which is huge. So doulas are not lactation consultants, but we do have a bit of breastfeeding training. So we have enough to help you get started and then to make sure that you have resources to help you along your journey, right? So if you're encountering challenges with latching or just anything with breastfeeding, because there can be a lot of challenges that I don't think women realize until they get started, doulas have resources that they can help you get the right support that you need. And then there's me and my support and the kind of work that I do, right? So I am a birth doula, but because of the ages of my children, so if you're new to me, just to recap, they're 5, 2, and 5 months. It's kind of challenging for me right now to get out of the house in the middle of the night if a mom were to go into labor. So what I've done is shift my doula work to the digital world. So I still provide support privately for moms, some in a one-on-one, all access type of program situation, and then some in a small group support. So we're talking private support circle of a small group of women in a very private setting, and you just get a lot more access to me. So we work on birth plans together. We talk, when women leave their doctor's appointments, we hop on the phone or we get on group calls together, depending on which program, kind of suits your needs. So I am doulaing women throughout their pregnancy as their support person. And then even when they're going into labor, we're working through the phone, because a lot of moms, what I'm realizing, don't hire a birth doula, either for financial reasons or because you're in a location that maybe you just don't have access to a lot of doulas, or because you haven't met anybody that you bond with. And the last thing you want is to hire somebody that you're not really clicking with to be there with you at your birth. Also, some husbands just can't get past that concept of having somebody there, but it's different if you're going into labor. A lot of moms will text me or send me messages and pictures of is this my mucus plug coming out, or I'm having contractions, and we'll start talking through things, and I'll work with them on figuring out when's the best time to go to the hospital. Basically being your doula that may or may not be physically present depending on where you are in the country and what kind of program, what kind of arrangements we've decided would work best for you. So what I want to do is, today is just day 1 of the Know Your Options in Birth. I wanted to kind of set the platform to talk about who does what and what your options are for your birth support team, because I think it's a really important place to get started, to think about who you want to be there. And who, if you're pregnant right now and you're watching this, it may not be your OB that you've been going to for the last 10 years. It may not be that person that's going to, help you have the kind of birth that you desire. And so I would urge you to start thinking over the next several days. I'm going to be coming on and taking on another topic about knowing your options in birth. And as we move along, hopefully you start to formulate some ideas of what you want, what kind of birth experience you want to have. And that way, when your day comes, you have the right team in place, because it may not be the same people you're seeing right now. And that's okay. This is your birth. This is